Uh, I think we can start the program now. A lot of participants are joining in, but let us start. Why? Because our speakers are in waiting. We will start our program. We are trying to record this program also, and if somebody is missing it, we will share it. So first of all, uh, our our first speaker is none other than Dr. Piyush Juneja. I think he needs no introduction, especially in Delhi NCR region, wherein he works extensively dealing with the different varieties of diseases. He is an expert clinician. He is a board member of Canadian Ayurveda Association. Also, after the AMF, done his Master of Business Administration too, making him adept in running the enterprises. He's an entrepreneur too. And at the time of COVID scenario, this as the pandemic thing, when I was searching good practitioners who were doing good work in the northern parts of India, sitting at Kerala, I accidentally came across the profile of Dr. Piyush, wherein he was getting his case experiences daily on Facebook, and I was a regular follower. And one important message which he conveyed as a teacher, I found it is very, very important. It is none other than he was telling that instead of going here and there, going behind some persons, you sit and learn the Samhitas Asana, try to admit, try to apply all those principles which are in Samhita in day-to-day clinical practice, especially related to Aushadhi. And I could learn a lot from his practice regarding the application of Kaphageduras, Jayamangal Ras, Chindamani Ras, and a lot more. More than the Aushadhis, I was fond of the principle which he was using. And I could see that the patients who are coming with SpO2 as low as 85 was being pushed up to 95 within 2 days. And many of the COVID negative patients were telling a great deal of their experiences, their subjective well being after getting treated by Ayurveda, by Dr. Piyush. So I welcome you, sir, wholeheartedly to this session on behalf of myself as well as on behalf of our consortium. Have your experiences shared for the eagerly waiting youngsters here. I want to highlight the point that this group is being bombarded by youngsters who are young clinicians who want to learn a lot. There is surely a revival of Ayurveda, of jump up of Ayurveda is happening. So, sir, with uh, to have your words, please take over, sir.
Thank you so much, Dr. Rahul Ramchandran Nair. First of all, I appreciate and congratulate you and your entire team that you have identified and you have tried to position actual clinicians. Because in Ayurveda, the irony is pseudo clinicians are everywhere, talking about the treatments, talking about the various like solutions. However, if you do a reality check, most of the clinicians, most of the doctors who are positioned themselves as clinicians, we are not able to get their footprints in terms of the treatment which they are doing actually. So, with due respect to all the fellow clinicians, there are very few real time clinicians right now, especially in the private practice, because challenges are different. And second thing is, prior to starting my session, sorry to disappoint most of you, I will not be talking on mild and moderate cases today, because I think each one of us who have invested 5.5 years of our time in BMS, and many of you are postgraduate as well, all of us are capable of handling mild and moderate cases. And we have guidelines from Ministry of Ayush, beautifully designed and well defined. So if we follow that guidelines, I think most of the mild and moderate cases will be easily handled. However, the problem is when any mild or moderate case will convert into a critical case, we never know. There is no tool, there is no parameter, there is no like test or anything which can determine from day one that this particular case will convert into critical or will need oxygen support or hospitalization. Yes, if we have exact CT value, so we can say in RT-PCR report anything which is less than sometimes we have seen 20 or 18 or maybe sometime 15 can be a risky candidate for getting into the serious issues. Otherwise, after a few days, we can have this chest CT scan in which if HRCT score is more than like 50% lung damage, then definitely they will be in the critical, and many doctors are asking them to get hospitalized. So these are the some criteria or CRP parameters, D dimer, and all these aspects are there. As per the Ayurvedic Nidan, also there are symptoms which we can see from the day one. I think all of you are aware. I will not waste time on those symptoms. I will straight away come to the point of management of critical cases and management of cases where they are on the borderline. So when we started managing the COVID cases, when we started doing the treatment, we have seen so many cases where they were hanging on a borderline. The situation was pathetic last month. Right now situations are getting better here in Delhi. I'm not aware about South. I was recently going on a couple of hours before that Kerala is having the highest cases right now in the entire country as a state. So I think most of you are from Kerala. So I wish all of you will be able to handle as many cases as possible. But in our city, in our region, last month the situation was so pathetic that no hospital bed, no oxygen support, nothing was there initially. Now many like platforms are there. Many centers have been converted into COVID care centers and all. Many Ayurveda centers and Ayush hospitals are opening up now gradually, but at that time that was not there. So one critical aspect was there in which we need to ensure that okay, this particular patient where oxygen saturation is going to 90s or late 80s or sometimes late 70s, how we can recover and how we can regain that is one critical point which we need to understand. So let me start my talk, and prior to starting my talk, now I can see around 100 participants are there right now. So why you will invest your next 30-40 minutes with me, as Dr. Nair has introduced. So maybe still you have some confusions and some clarifications you need. I will do one thing. I will just show you some screenshots. I was not able to get time for a presentation, which I will do eventually. We did one presentation last week on our platform. You can note down. I will write the name in chat box as well. If you want to go through that presentation, there is a compilation of certain tips to patients, compilation of certain tips to Ayurveda doctors. So you will get that on the Facebook and YouTube if you type this name, that is indianvadyas.com. So today I will not waste time on the all the aspects which have been taken care of. You can go through our YouTube or Facebook platform and you can pull out those videos and see that around 1 hour videos, around 3 sessions we have done till now, in which you will get a fair idea, clarity on the treatment protocol, clarity on how to guide patients, clarity on what exactly the things you need to understand as a clinician. So many aspects we have discussed in those videos. So I request after this session, whenever you will get time, you can go through those videos, in which, and many doctors across the country has also they have submitted their experience, their tips in the comment section. And if you are already practicing and if you are already dealing, we request you can also share your details there, so that everyone will be aware, and whosoever is seeing that video, one video crossed around 1 lakh, the first one. So across India, people are seeing, and we got this feedback from many Ayurveda doctors that they are getting queries and patients in terms of COVID cases are concerned. So our whole idea is to create this platform, which I think was missed in the introduction, that I am the founder of this platform, that is indianvadyas.com. However, this platform is for all of you. I am just a founder. I have just started this, but you all need to carry it forward. Everything is completely free of cost. We are not charging anything to any Ayurveda doctor. You can have a profile and you can list yourself. You can mention that you are treating COVID cases, and people across India can connect you. We are there for more than around 20 cities. We are on the first page of Google. So if somebody is searching Ayurveda clinic or Ayurveda treatment in your nearby location, they will get to know about your profile on our website, that is indianvedyas.com. So please do that if you have not done till now. So let me just show you, just a second. Yeah, so let me just show you these screenshots. So these are some reviews. Again, uh, I think there is, you are able to see, right?
No, sir.
Okay. So there are some, so there are some screenshots, and you can go through all these screenshots. It's just my business listing on Google. You can just type name on Google and you will get to know. And you can see so many people have posted that they have now recovered. I can specifically talk on 2 3 cases and then I will go to the standard discussion. But why I'm showing to you this, already Dr. Nair has introduced, but still you need to have faith and you need to have this confidence that this person who is talking and who is taking your precious time in these challenging times will make some sense to you, because they are already dealing and they are already handling several cases till now. More than 150 cases have been resolved, and approximately the same number is right now continuing. So around 300 350 cases we have done till now. And if you attach the family members and the adjacent members who have copied the treatment from their respective prescriptions of a particular member, the number will goes to around 500. So these are some reviews, these are some feedbacks and testimonials. um, like this particular person was from a society where daily people are dying. The strain is so deadly that we are getting news, but he was fine. He immediately started, because he was our previous patient, so immediately started medicines, and he was fine and he was doing well. Today only he visited my clinic and he is now negative, and all the symptoms are resolved and nothing is there. Then just a second, I think there's some issue. Okay. So then there are so many other cases like this one. So this person, as you can read, that they have a family of allopathic practitioners. So one more point which I want to convey here is many people are trying to prove that Ayurveda is superior or allopathic is inferior or that kind of stuff. I request do not do that right now. We don't want to right now get into any issues. So we suggested to all the patients whosoever, although many patients have taken standalone Ayurveda, like this person, let me just show you. Yeah. So this person was other. She was personally want to avoid chemical treatment, so he opted for only Ayurveda treatment, and he is fine. His wife is also fine. But this family, they were having allopathic practitioners. The entire family was having allopathic doctors, so they insisted. So we said, okay, fine, no problem. Along with allopathic, you can have Ayurveda as well, and they are fine. Her father is fine, and the entire symptoms were very well managed, and so on. So many cases are there. I don't want to waste time. You can just pull out any case you want. So many cases are there. Uh, okay, this one also I want to emphasize. So this lady Jyotika, her mother was initially not taking Ayurveda again due to some apprehension, but her vitals started falling, and this oxygen saturation goes into around 88 87. So one more important point, always check daily. I repeat, always check daily to all your patients. We check daily all to our patients that whether they are taking medicine or not, any issue. So then they conveyed that she is not taking, and then we emphasized that okay, you need to take that, then only you will be able to uh, get it resolved. Let me show you one another case. I will prepare the case studies and later on. So this gentleman, we lost his father. He was a senior citizen. A strain was so deadly there, like values were also very high, 14, 15 CT values in RT-PCR means very acute infection. Father was not able to survive. Some cardiac event was there when they hospitalized him. I don't want to comment what exactly the doctors administered, but that was the event. But still we were able to manage him, his wife and his daughter. So all these case details are there, and you can read their narratives, and you will find like this one. Again, this person was, entire society was sealed, and you can see the RT-PCR CT score was 14. Again, 14 RT-PCR CT score is very acute infection. and all the symptoms were very high, and we were able to manage easily. The only key is all of them have taken regular treatment without missing any dose, and that ensured this case is unique. This case is unique. Her husband was in ICU after administration of 6 remdesivir injections and 2 plasma therapies. His oxygen saturation was 25, and doctors have given up that we can't do much now. And then they allowed Ayurveda medicines in the ICU, and we were fortunate enough to recover him after that, and now he has been discharged. So this is a very unique case which we have faced. Otherwise, many cases are there. Her mother-in-law again fluctuating vitals as she has written. So let me just stop here for a while. So all these case studies are there which you can see and go through on our profile. Now let me quickly start the treatment protocol which you need to understand, which we need to ensure. So first and foremost, some general tips for all of you. As Dr. Nair mentioned, see, nobody is big. Nobody is having more knowledge than our books. So I request all of you to open up your books, what we have done, but I have done personally initially when we got this challenge. So right now I am following these two books. I don't know if you are able to see. So this is Rasendra Sar Sangrah, this one, and second one is this Rasendra Chintamani. So these two books I am following right now, and when we discovered, when we opened these books, and when we read about certain formulations, so specifically there are few formulations which are very effective, and it has been already written in our textbooks that are very effective in terms of managing the fever. Fever means infection, and managing the respiratory system, specifically the viral pneumonia, pneumonitis, which is going on right now. Oxygen saturation and other vitals are the symptoms, are the parameters which we need to understand. But the root cause is, once we start controlling the viral load, once we start controlling the cytokine storm is the causating factor. So the interleukins are responsible for that. And when this virus start aggravating in your body, and when this interleukins start getting increased, so this cytokine storm increases, and then it leads to inflammation, damage to the organs, lungs specifically, primarily, and then pneumonia develops, and then ultimately the patient start deteriorating in terms of the vitals. So that is the entire pathology right now we need to understand. Now when we use these medicines, when we administer these medicines, we have seen very good results initially. When we started with specifically, if you want to talk about preparations and formulations, the Mahalakshmi Vilas Ras. So let me just prior to discussing the formulation, let me just discuss the principle which we have followed in our clinic, in our patients. So we started when we started getting these cases, what we have done is we analyzed, okay, if somebody is senior citizen, somebody is having some comorbid situation, the infection is high, the symptoms are there. However, we were wrong in few cases. Initially there was no symptom, asymptomatic, and suddenly symptoms developed overnight. So then we changed our protocol, and what we have done now, maybe many of you will say that is wrong, but we don't want to take chance. And in private practice, as I said, there are challenges in terms of your stake, your name, and everything. So what we have done is we have started advocating at least two Swan Yogs initially to start with. Treatment is not that much long. It is maximum 10 to 15 days. Maximum 10 to 15 days, not more than that. Actively 15 days gone from the day of symptom, onset symptom, or maybe report, you can count. 15 days is the time. So if 15 days gone, then you can be like safe with the patient. And many patients have shown positive reports after 15, 16 days as well. But the CT value is generally 28, 29, 30, which is very mild. And at least we can say patient is out of danger after 15, 16 days. So that we need to understand. However, if damage is more acute, then maybe we need more time to stabilize the patient. Still, they will be out of danger, at least with oxygen support at their home. We can manage them with the Ayurveda medicines and whatever standard of care they are taking. In fact, in many cases, steroids and allopathic medicine are causing more harm rather than resolving the issue. So the treatment protocol is start with at least two sword yolks if patient can afford. If not, at least one Swan Yoga and one non-Swan Ras you can add to the treatment protocol. That is very, very important because that will check the viral load from the day one. That will ensure that it will not increase fever parameter. We need to do counseling also. So fever we have seen will not rise more than 101 or 102, but it will remain to 9900, and people start getting panic and they start popping up paracetamol or antipyretic pills, which we need to stop. We need to understand this as clinicians, that if fever remains in the patient for few days, it will also help us to decrease the viral load. If somebody is starting paracetamol along with Ayurveda, it will come down to 98 or sometimes 97 as well, which will ensure that virus will damage the other parts, especially the lungs. So when you starting this Ras Aushadhis, especially the Swan Yogs, immediately ask them not to take paracetamol until or unless it is more than 102, 103. And many patients have tolerated 102 and 103 also with Ayurveda medicines, which we have seen their lungs are very much fine and no damage to the lungs after 5th, 6th day or 7th day. So that is first principle you need to understand. When you start the treatment, patient will come to you. They will see the efficacy of Ayurveda medicine in terms of the temperature control. They will not understand the viral load, they will not understand the other things. They will just say, doctor sahab, fever to it's not decreasing, fever is not decreasing, we are not getting normal temperature in our thermometer. So that you need to understand, right? Second is, if we talk about the oxygen saturation, again it will fluctuate, but if you start timely, I promise you it will not be drastically down unless or until there is some serious issue with the patient, some previous history of bronchitis, COPD, asthma, cardiac issues, uncontrolled diabetes, abusive administration of allopathic medicines. So many issues are there, smokers. So in those cases there can be risks, but moreover in general it will be maintained. Maximum, if you can see some dip, you can ask them to have oxygen support. That is the best option rather than asking them to going to the hospital if it is not getting below 80. In 80s you can easily manage at a home setup with an oxygen support, along with the Ayurveda medicines and whatever send off care they want to take. It's upon them. We don't interfere, we don't avoid, or we don't recommend as well. So that we need to understand. So first thing is the temperature control, which they always ask you, but you should counsel them, okay, it will be there, you should manage that and immediately start two Rasoshadis, preferably both Swan Yogs. If not, at least one Swan Yog and one other non-Swan Yog. Now which Rasoshadis? In our experience we have seen excellent results with Mahalakshmi Vilas Ras, that is with Swan, with gold. Jamangal Ras is, I can say, the drug of choice for ensuring a control on viral load. In fact, I requested certain companies, and when we explored the textbooks, Jamangal Ras is also being advised to be given as a nasya or to be given as a anjan in many diseases. And this fungal infection, which is also causing some death, we can explore that as well. We have not came across any case till now as far as this fungal infection in our practice, but we can keep that in mind as well. Still, as far as initial viral load decrease is concerned, Jamangal Ras is very effective. One TDS is sufficient, but if patient is critical, in RT-PCR you are seeing high CT, high infection means low CT value like 14, 15 or maybe less than that. 2 TDS should be there. Many people will argue the dose is high, but at least for initial few days we have to maintain this to ensure quick resolution. You have to check blood pressure because whenever you are administering Swan Yogs, especially the higher ones, blood pressure can go down. Patient can go in hypotension as well. Pulse rate is very, very important. Oxygen saturation and temperature will definitely go. At least these four vitals you need to maintain. However, sometimes other concurrent infections are also there, so get a CBC profile. Also platelet counts are also decreasing. Sometimes we have seen people are coming with typhoid or some liver issues as well, infection in liver. So these things also you need to keep in mind. Now when you say, but apart from Jaimangal and Mahalakshmi, the specific formulation which we have discovered, and when we have gone through these textbooks which I have showed you initially, Trilokya Chintamani Ras has been specifically mentioned in our textbooks for the lungs issue, or I will say the pneumonia. Especially in these cases, we have seen when we have fortified that with Abrak Basam. Um, in critical cases, we can add Hirak as well as Samir Pannag. We have seen very good results. Now, coming back to the aspect of Trilokya Chintamani or maybe any other ras is concerned, always remember one thing. In our textbooks, each ras is mentioned sometimes multiple in multiple chapters with a specific formulation. So, what we had to understand is, like for example, let me take an example of Trilokya Chintamani ras. Now, this Trilokya Chintamani ras, in fact, let me show you the real time. Just give me a second, Amit. Just give me a second. This one is I have from Dabur. So what I want to show you here is, and I want to convey to you, ego Badnath wala bhi na. So this Trilokya Chintamani, if you see from Dabur, this one, this they have referred to again Rasendra Sar Sangrah, which I have shown you. So you can pull out the bottle upar Badnath wali. So if you are able to see, I don't think so. If you are able to see, you can go to the Google and Amazon. You will see that. So they have gold and pearl, and their reference is Rasendra Sar Sangrah Jwar Chikitsa Prakaran. ऐसी दे दो. Then this one is from Baidyanath. So in Baidyanath, again the reference is Bhaishajya Ratnavali and Pandu Rog Chikitsa is there. Now, if you study the formulation is entirely almost same, except in Baidyanath, Abhrag is not there. Other constituents are there. So that is one tip, one suggestion. One suggestion I want to give to all of you whenever you are going through these aspects. For example, if somebody said Trilokya Chintamani, okay, you start prescribing Trilokya Chintamani without checking which company is referring which chapter, which prakran. So that will also matter. And I have seen other ras oshadis also in the same manner. So always check that aspect as well as a clinician, because we have seen, when although excellent quality for both companies, still when we have fortified Baidyanath Trilokya Chintamani with Abrak, we have got better results. In Dabur already Abrak is there again, but we have fortified that as well, right? So the dose is again 2 DDS or maybe 4 to 5 times also in critical cases we have seen, along with Abrak Basam. Abrak Basam we have used generally 250 milligram, but if again the case is critical in 80s or 70s, we have used 500 milligram as well. Sahasrapruti is best, but not that much available. Shatpruti will also fine. And along with that, if patient is again in critical, maybe in ICU, then you can add Hirak Basam. You can add Hemgar Portly Rus as well. Again, a very wonderful Portly Rus formulation in patients with critical issues with a very minor dose, and very judicially you have to use this, because all these these are having deadly side effects as well. I repeat, deadly side effects. So please use with very cautious way. Always monitor the vitals, and anupan is also very very important. So for example, adrak soras is the best anupan if we are dealing with the pneumonia in lungs. Otherwise, madhu is also there. But if somebody is diabetic, please do not give madhu, because already they are on sometimes steroids and their diabetic level is going high. So then again, and madhu, especially in India, most of the honey are with sugar. So that will again act as a catalyst in increasing their sugar levels. So that is a very common mistake which we do, that okay, आप शहद में मधु में you can just combine these things and you can give, but that will not help to the diabetic patient. In fact, non-diabetic patient is also getting diabetes due to steroids and other allopathic medicines. So then maybe with some water or uh, almond paste or some cream or anything you readily available with them, you can do. Otherwise, shastrok you can read and you can prescribe. One more tip with ras oshadis are there, and generally when we follow this vatpit kaf rule, maximum ras oshadis are not specifically categorized in our sahitas, in our textbooks, but anupan is categorized that if you have some vataj lakshan, you have to give with this anupan. If you have some pittaj lakshan, you have to give with this anupan. And if you have some kafar lakshan, if you have to give with this particular anupan. That you need to remember, right? So ras aushadhis again, as I said, Jaimangal, Mahalakshmi Vilas Ras Gold, Trilokya Chintamani, These specifically we have used along with whenever Trilokya was not available. We have recommended Shwaska Chintamani, that is also good, working fine. We have also fortified with Swarn and Rajat Bhasam as well sometimes when the situation was more critical, or sometimes we have seen patient is not able to get any formulation like Trilokya or Shwaska. So what we have done is we have taken Swarn, Rajat, Abrak, Bhasm, and we have equally like distributed that and given them to the patient. So that challenges are there because Ayurveda medicines are not readily available at each and every uh, city. And if anything which is non-swand, you can add swand additionally as well. So many times we have seen Shwaskothar ras or Mrityunjay ras or Kaf Ketu ras, non-swand ras aushadhis, and along with that we have added swand bhasam and given to the patient. That can also be done, right? So these are the some ras aushadhis which we have used. I repeat, Jaimangal, Mahamrityunjay, uh, Mahamrityunjay again. Let me clarify. So sorry, Mahalakshmi Blasters, Jaimangal, and Triloki initially. Now, when the patient is coming, that fever is not getting decreased after a few days, after 10 days, 15 days, 20 days sometimes. Fever is not getting normalized and it is stuck to 99, 100 sometimes. Mahamrityunjay is a very effective Rasaushadhi at that particular time as well. For Visham Jor, it is mentioned, and we have seen very good results with. We have seen good results with Jamangal also. If somebody is taking initially, but Jamangal is a bit costly, so then patients sometimes resist. Mrityunjay is not that much, or Mahamrityunjay is a bit, but not that much as compared to Jamangal. That also we need to think and we need to take care in a private practice setup. Then many times we have seen loose motions are there. So Anand Bhairav Ras is also a very good option for Jwaratisar. It is mentioned in our textbooks. So that you can use if patient is having loose motions along with the other symptoms. So these are some Rasoshadis. Then Lakshmi Vilas Naradiya is also good. In non-sound you can take Mrityunjay, Lakshmi Vilas Naradiya. Samir Pannak is also a very good Rasoshadi for lungs, for managing damage to the lungs and reviving them. Mrik Shring or Shring Bhasm is also there. So many, in fact, Oshadis are there. By the way, in US, in many countries, nanoparticle gold and silver have been researched, and it has been proven that these are very effective in managing the COVID virus. One more ingredient and one more very important drug which I have to uh, convey here today, not being practiced much in India right now, but we have used in certain cases because many of our patients were taking as well earlier, and we have seen a very good management with that. That herb is cannabis, vijaya, or bhang, CBD oil specifically. The active ingredient that is effective is CBD. Earlier we were discussing the cytokine storm. So when we have fortified our treatment with CBD oil, medical cannabis, this medicines, and I want to convey here, please do not use any tablet, powder, or any other classical preparation. Use CBD oil tinctures because the bioavailability is best when it is being either taken as a vape form. So the cigarettes or the smoking of cannabis is not legal right now in India. It is legal in some countries, but not in India. One company has manufactured the Dhumpan of Vijaya. Let's explore that and we will come back to you for that whenever we'll get a chance. Still, it is not readily available, but CBD oil tinctures are readily available. So you have to put few drops under the tongue. It will be absorbed sublingually. So the maximum bioavailability will be there. And we have seen, I don't want to use this word tremendous or whatever, but we have seen very good results, excellent results in patients recovering along with Ras Oshadhi, Swan Yokes, and this cannabis. Easily we are able to manage so many patients, so many critical patients, patients in ICU and on oxygen saturation. So CBD oil and cannabis, again we have done some sessions on our platform. You can go through that. The dosage, how to use, everything has been mentioned in the videos in our YouTube channel or on our Facebook page. You can explore. If you need any specific session, we can always do along with Dr. Nair later on. But right now, just as if we have limited time and we have another speaker as well, I think I have only next 5 to 10 minutes to conclude. So this cannabis and Vijaya is very effective in managing cases along with the Ayurvedic Oshadhis. Now coming to 2 3 more aspects. So along with the Rasoshidhis, we have also selected wisely some syrups and some oral, you can say, syrups and herbal polyherbal formulations, which are also very effective. Now what happens is, when you give this rasaushadhis, along with that you will give some good syrups that will also help them in controlling their cough, the breathlessness, and other issues, and the absorption is also better. One standalone syrup which we have seen is a Siddha preparation, by the way, not Ayurveda. It's a Siddha preparation. It is known as Shwas Amritam. The formulation is excellent. We have seen very good results in many patients when we have given that 2 spoon TDS 3 times or 4 times, and it's having very good effect on the overall improvement and overall like coughing and then healing the lungs and so on. Again, many other companies are having good formulations, like for example, Wupin is there from Sandu, Broncorid is there from Dabur, and any South Indian companies are also having good preparations. But in North, we have this readily available. Jufex is there from Emil. Jandu is also having good cough syrups. So all these companies are having good cough syrups, and you can use that as well. Always have one or two good syrups to be given, and we have asked them to make a decoction in a water. They can add 2-3 spoons of this syrup. They can add some honey if they want, or kadha. Kadha again in powder form is again having some gastritis or hyperacidity. We have used drops. A couple of companies are having drops, kadha drops. So we have asked them to put drops in their drinks, in their water, and all these aspects, and it has been shown very good results. Now, along with Rasoshruti, what we have missed is, when we were talking about that, there are some basic formulations. In fact, it also has Ras Oshadhis, but what happens is, in some cases where they are on the medium level, they are not that much critical. So many times as a clinician, we also don't want to unnecessarily give them excess of Ras Oshadhis or Swan Yogs, and patients are also not that much sometimes interested in bearing that much of cost. Ideally, I repeat, it's better to have two Swan Yogs, but if one Swan Yog and one non-Swan Yog, and if non-Swan Yog is not available, you can have medicines like some companies are having, that is Trishun from Jandu. We have used Fifatrol from Emil. We have used Flurin. One company is there in Ghaziabad, so they are also having Tribhuvan Kirti, Ma Sudarshan, Ganvati, and these are the simple preparation. I don't want to take time on these preparations. All of you are aware about Giloy, uh, Ma Sudarshan, Ganvati, Tribhuvan Kirti Ras, Sanjeevani Vati, and all of you are using that. So I don't want to go to that discussion, but we have used as well in many cases along with the Ras Oshadi. We have used these medicines also, and we have got very good results as well. So that can be the ideal prescription. Yeah, along with that, you can have some immunity boosting formulations also. Although we always counsel to all the patients, it's not a single day activity. It has to be a prolonged activity, but still you can have some herbs, some formulations which at that particular time, because on one side what is happening, the allopathic protocol is damaging and decreasing their immunity by giving them steroids, by giving them antibiotics, by giving them antivirals, and all these formulations are decreasing the immunity, hampering the immunity. So when we give Ayurvedic treatment, we give some immunity boosting and immunity supporting medicines also, which will help them at least to maintain and to regain the strength and the immunity. Rasayan Chikitsa not advisable at the time of active treatment, but yes, at post-COVID management, then you can add on some Rasayan to revive them. You can add good chawanprash, avles, grits, and many other preparations are there. But right now, at active time, we have given these kind of protocols to all the patients. Now, one question is about the diabetes. So, Vasant Kusmakar is a again drug of choice. If you have diabetic patients, you can always have that in your treatment protocol. So when you start this and you know that they are having diabetes or drug induced diabetes is there, you can always give Vasant Kusmakar. Is a very good, although a bit expensive, but is a very good formulation to manage at that particular time, and accordingly you can take it forward. And as one more question, I can see that yes, you are absolutely right. Most formulations have sugar in it, so we have figured out some companies with sugar free cough syrups. We have figured out there are some companies in Jhandu also. I think there is one. Then we figured out one from, I think, Vasu is having some sugar free. Charak is also having some sugar free syrup. Himalaya is having, I think. You can figure out in your vicinity which is available, and you can give that to the patient. Very good question. We also realize that maximum syrups are coming with sugar as a base, so we can't give that in the diabetic patient. So this broadly the treatment protocol we followed, but some tips and some suggestions I want to give, and then I will conclude my session. Hope I'm not taking much time, and I have more 5 minutes more. So the tips are, always do regular monitoring, daily vital checks, always do counseling. They will come up with this issue that allopathic doctors are not allowing Ayurveda medicines. Counsel them and ensure that they should continue with Ayurveda medicine. We don't have any issue, whatever the stand of care allopathic medicine they want to take. However, day by day, every medicine is getting failed. We read about ivermectin, we read about remdesivir. Today we read about plasma therapy, and everybody is saying that nothing is advisable. All these medicines are deteriorating the patients, um, developing the mutations. So many statements are there. Still, the society is like that. Still, the mindset is like that. That patient wants to start allopathic medicines also. Sometimes the situation will get critical. So, as a OPD clinic, you don't want to get involved into any issue that you emphasize, or you pressurize them to have only standalone Ayurveda. And if something goes wrong, it will come up to you. So, better to have a defensive approach. On one side, I am saying the critical cases can be easily managed with Ayurveda, so we have to be attacking to the virus. On the same side, please do not get into that mode that okay, with only Ayurveda we can manage and we can do everything. This is not the time. Let researchers do some more research. Let government and organizations do some more research, and then only we will be able to position standalone Ayurveda. But right now, as a private clinic, we can't take that risk. So we have allowed whosoever wanted to have. But many patients have standalone Ayurveda as well. They don't want to take allopathic. They don't want to take steroid, and they are doing, most of them doing are fine. Only thing which happens was they were on the oxygen support for some time, which we need to understand also. And by the way, in oxygen support also, you need to understand, you have to decrease and you have to temper initially, gradually, because sometimes we have seen patients are unnecessary on the support and their lungs are not able to functional without support. So that is very very important. Prawn position, I think all of you are aware. Pranayam, breathing exercise, all these help along with Ayurveda, ras aushadhi, swan yogs, which we have discussed uh, uh, right away. So all this will help, and you will see good results in few days only. You can always increase the dose. You can always monitor them. Diet very very important. Avoid curd. Avoid dairy products, especially coconut water. I understand in South India is very prevalent, but in viral pneumonitis, acute viral pneumonitis, strictly no. And have hot water, have steam sometimes helps, steam sometimes aggravate cough as well. So again, case to case basis, you need to understand and you need to advise them, ask them to take good diet, but still not that heavy. Avoid spicy, oily. Citrus also sometimes can be a challenging, although we are seeing some communications for immunity boosting. But these are some ground level challenges which you need to understand, and you need to do counseling of the patients. And if 10 to 15 days will go fine, nothing will happen. And if you start timely, time is the key. The more you delay, the more critical the case can be. So if you start timely to each patient, and if you have to counsel them as well, I don't think so there will be any issue with this particular protocol which we have followed till now. And we have received very good results. There are some more formulations and there are some more medicines as well. So what we will do is, due to the limitation of time, I'm not discussing the entire thing, so that you all will get confused as well. Some specific formulations we have discussed, which we received maximum results. But we will keep on posting all of you on our platform, which we have just informed all of you. You can follow us on Facebook, and you can see the details. We have a Telegram channel, we have WhatsApp group as well. But wherever you are comfortable, you can connect with us, and we will keep on posting about all these formulations to all of you, so that all of you can, and again the entire reference is from the textbook. Let me quickly have some more questions, and then maybe we can conclude. So where to find the therapeutic of CBD oil? Okay, so CBD oil is readily available with many companies. We can connect with them. If you feel any challenge, what I will do is, let me share our email ID. You need any support, you need any connect with any company in terms of the products, we are not The YouTube channel is Indian Vadyas. We are not charging any commission. We don't have any commission model. We will just connect you to the companies, and you can take it forward with them directly. Whatever the maximum discounts you are getting, you can directly deal with them. And diabetes already we have discussed. Main indication of CBD oil. See, CBD oil is having various indications. Vijaya and Bhang and cannabis is having a multi-dimensional indication. Specifically in cancer patients, we have seen very good results. In pain management, we have seen very good results. The receptors are being uh, healed as far as the active ingredients, that is CBD and THC, cannabidiol and tetrahydrocannabidiol. These two are the main ingredients which are responsible for healing, and they work directly with the receptors in our body. And in worldwide research, it has been shown excellent results. And specifically, if we are talking about infections, the antibiotic resistance, that is one issue, the superbugs. It is very effective. Many research studies are published, and in various viral infections, including COVID also, it is a very good drug of choice if you add to the standard treatment of the Ayurveda, which we have discussed. Vasant Kusmakar Ras general dose is 1 TDS is sufficient, but again the levels are very high. You can always increase the dose. Post-COVID cough management once patient is negative. Very good question. Right now we are using some Avlays, Amastha Avlay is there, and then we are using some this syrups also. We have given them Shwas Kuthar, so sometimes if acute cough is there, Shwas Ka Chintamani or Triloki also in follow-up. In active, it can be 2 DDS, but in follow-up 1 TDS or 1 BD also, to sometimes heal the lungs which are not that much healed after the patient is negative. That can be one cause of the cough. Uh, up to which level of oxygen we try only with Ayurveda medicine? Very good question. I think, in our clinical practice, what we have said to patients, what we have conveyed to patients, whenever you have less than 90, start getting the backup as far as the oxygen support is concerned. Less than 90 will trigger the oxygen support, but do not wait. If you are having 94, 93 or 92, just do a prone position, just increase the dose and see if in few hours you are getting better. That is fine. But if you are not, start looking for an oxygen support. Oxygen concentrator or oxygen cylinder at home is sufficient, along with Ayurveda medicines which we have discussed, will definitely heal and improve. They want to take some allopathic treatment or medicines also. Sometimes steroids helps for a few days, and then we have to taper them and remove them from the stand of care. That is the only thing which everybody is doing right now. So that is the way. And if still patient is deteriorating and it is getting less than maybe 70 and all, then definitely hospitalization. Or maybe if sometimes hospitalization is available easily, they can shift to hospital with an oxygen bed, or sometimes in ICU also if the situation is getting worse. But we always chase their patients. We always ensure. In fact, we have discussed with certain allopathy doctors also who were managing those patients, and we were able to convince them to give Ayurveda medicines in ICU and on ventilator sometime as well. Uh, uh, they were just removing that, and we requested and they have given them. So these kind of challenges are there, but yes, you need to understand as a clinician and mind, all of you, you are dealing with an emergency medicine and a critical cases. You have to be very very vigilant. You have to be very very, um, I will say, your eyes and ears and everything should be very very open 24/7, because anything will happen to patient anytime. Patient call us at 2 o'clock, 3 o'clock in night as well. Your phone should be always on ringtone. You should always be available to them. You should always be guiding to them. That is very very crucial, which we all need to understand. Right. I think we were trying to answer all the questions, and some people are asking the. Let me share the WhatsApp number also here. You can quickly send us a message, and we will add to the groups and the platforms which we have, and accordingly you can take it forward.
Yes, sir. Yes, sir. In between, I missed your Q&A session, why? Because I went out due to network problems. I think you have finished all the Q&A now, sir. Myself, Dr. Rahul.
Right. So I try to cover up all the aspects. Still,
Still,
we
we
can
can
have
have
more
more
discussion
discussion
and
and
more
more
exhaustive
exhaustive
session
session
later
later
on.
on.
But
But
as
as
we
we
have
have
Dr.
Dr.
Putin
Putin
also
also
another
another
speaker
speaker
of the
of the
day,
day,
so
so
let's
let's
conclude
conclude
right
right
now. And
now. And
hope I
hope I
was
was
able
able
to
to
clarified and able to address
Sir,
some
sir,
issues that.
one question from my part, sir.
Yes, yes, please.
Sir, in Kerala, as per the death analysis report, almost 30 to 40% of patients who are dying due to COVID are kidney patients, those who are having chronic kidney disease. So, if I missed your Q&A, I don't know whether you have answered it or not. Sir, what should be our approach in such a case? If you are getting a patient of COVID with chronic kidney disease.
Very good question. I think this is a very important question because what aspects we need to understand. One side we are dealing with all these rust societies having heavy metals, although these are in the form of nanoparticles that will not damage or that will not have that much of impact on kidney, but still it is a bit risky. So what we need to understand is whenever we are using rust societies in kidney patients, see, this is a situation of emergency. So we can't avoid and we have to save life. On the other side, we also have to save kidney. So now, if in CKD and in kidney patients, there are two, 3 criteria. If they are in a mild or moderate level, where they are not on dialysis or they are not on the stage where kidney is getting failed, in that scenario, you can always add on certain herbs, certain medicines along with the rest societies to ensure that it is getting, the kidneys are getting protected and it also helps in the excretion as well. Like for example, we have used Gokshur, we have used Chandraprabhavati, we have used very excellent formulation from company Aniel, that is Niri KFT. So the KFT syrup is very good. When we administered, we also had some kidney patient. In fact, you can read my review, one latest review of the today. He is himself a kidney patient, and then he got also his sister got infected, but he also has taken some prophylactic treatment. His Niri KFT and Gokshur Blue and Chandraprabhavati are going on. And there are so many other preparations in South India. In fact, in Kerala, we have learned from Kerala as far as the caste management is concerned, Panchkarma is concerned, herbal medicines are concerned. So you have so many other preparations. You have so many other kashyams and all these preparations. So you can use any kidney punarnava and many other herbs are there. I don't think so. I need to discuss all these. You all are aware. So you have to add some these herbs along with the rest which you are managing, and immediately when patient is getting relieved, the critical days are gone. Immediately stop that rest and then also continue with some medicines to ensure proper excretion from the body in a timely manner, so that it will not damage or it will not have any effect. Although it will not, if you are using good company medicines, they will not have any impact directly, but still there is some risk. So you have to manage accordingly, and you have to ensure that you are adding, you are fortifying your treatment with these medicines, which will ensure that kidneys are safe and kidneys are. Still, you can have at least 1 or 2 times in your 15-20 days of treatment the KFT levels to be checked, so that if anything is going wrong and its parameters are getting elevated, immediately you can modify or temper your treatment. So I repeat, all these important blood parameters from the day one. Generally, people are just seeing the RT-PCR report and immediately they are starting the treatment. Please do not do that. Have some blood parameters with you, because we have seen platelet count in few patients but drastically getting decreased. They don't have dengue, they don't have any other infection, but this COVID virus is causing some damage and platelet count is getting decreased. So immediately we have added some medicines which increase their platelet count. Then liver is also showing high, in fact multiple times high level of SGOT, SCPT, and sometimes bilirubin is also increased. So you have to include some preparations of liver protective formulations, Bhumia, Malki, and many other liver tonics and liver preparations are there. So these kind of things you need to understand, and accordingly hemoglobin is getting decreased sometimes. CBC count is very important. CRP D-dimer are there, which will definitely reduce with any good Ayurveda treatment. So don't bother that much on that aspects.
Wonderful, sir. One or two questions are also remaining. I think so. I will air it to you. And post-COVID care with Ayurvedic medicine, you have already mentioned, I think so. Nasya medicine, they are asking, sir, are you practicing it?
Okay, so Nasya medicine which best to regain smell and taste. Very good question again. See, two specific oils which we are using in our day-to-day practice, that is Anutel and Shadbindu Tel. However, we have fortified them with some Ras Aushadhis as well. What we have done is, in acute cases where viral load is very much initially, so when we have again, you all can go to the textbook, there are certain Ras Aushadhis which are mentioned to be given as Nasya, like I mentioned about Jamangal Ras. So in Jamangal Ras, Nasya and Anjan is specifically mentioned, and there are some other Ras Aushadhis are also mentioned, which you can give it as a Nasya along with these carrier oils. So these, although these are the main oils as far as Anutel or Shadbindu Tel is concerned, but these can act as a carrier oil, and you can fortify them with the Ras Aushadhis which are indicated, and that can help in decreasing the viral load, and eventually the loss of smell and loss of taste is a symptom. Once your body will have reduced viral load, automatically it will come back. So again, counsel the patient, ask them not to panic. In fact, many times people are not doing Nasya also. After getting the medicines for some days, their smell and taste resolved. But it's always better to ask them to do, if nothing is available, mustard oil, coconut oil, whatever is available at home, they can do from that particular oil as well. That is fine. Steam inhalation, I have already discussed. Gargles is very important. There are some preparations of polyherbal formulations as gargles. Still nothing is available, they can use again mustard oil with some salt or coconut oil, or general mouthwash or gargles are available, whatever they want to do. But Kawal Control is having a specific role, specifically in managing, so it's better to have with the Ayurveda oils and Ayurveda preparations.
One more question is regarding Rasamani. And from my part, I want to ask you about Brihatkasturi Bhairava.
Yeah, so one is Sameepannagras and another is Rasmanikya. See, Rasmanikya again is a very good formulation, and in fact in these formulations which we have discussed, let me show you. I think okay, in this there is Rasindur, but in one formulation I am not remembering the name, they have added Rasmanikya. So Rasmanikya has two roles. One is standalone, you can use, and other is in some formulations Rasmanikya is as an ingredient you can see. So Rasmanikya is having a very good results. It is safe to use as well, but again I request all of you to fortify that with other ingredients as well. Like if you study the formulation of Triloki Chintamani, so it is having Rasindur, then Fern, Rajat, Abrak Basam, Low Basam, Praval and Mukta. So this is the fortification of many basams in particular yog, which is providing us the very good results. Because one side we have Rasindur in which mercury, sulfur and all these aspects are taken care of. Other side we have Fern, we have Rajat, we have Abrak, and in Jamangal we have Vish as well. So Vish is very effective in those Rasaushadhis where we have Vish, we have poison, purified poison. That is also very effective in controlling this, because again if you translate, virus is Vishanu. So if you do Chikitsa of Vishanu with Vish, you will get very good results. You can note down, and many of our practitioners have used. We have not used directly, we have used in formulation, but they have used standalone Vish as well, like Vatsana, Butchla. They have the experience of using standalone Vish Dravya also. So if anyone of you is having that experience, because you have to be very cautious when you are using direct Vish to any patient, but that is also as far as Sameepannagras is concerned, it is an excellent drug of choice for lungs, for specifically the respiratory system, for managing the pneumonia, for reviving the lungs. It is a very good formulation, very inexpensive formulation, can be easily used, and can be a part of your combination of drugs which you are using.
What about Brihatkasturi Bhairava?
Sorry?
Brihatkasturi Bhairava, sir.
Brihatkasturi Bhairava is also very good, and bronchodilation is specifically the role which we have seen with the Kasturi, and has been again whenever the patient is in a critical situation, Hemka Potli, Brit Kasturi, Brit Sanjeevani, these are the specific ras. Please do not use initially, but whenever patient is getting into that stage, into the critical stage, then you can use with a very moderate dose as per the condition of the patient, age, body weight. You can decide and you can use, but all these are the life-saving Ras Aushadhis, I can say. Right. I think already we have spent much time and we have other speaker also. But I suggest you that I have shared my number and email ID. I will be happy to answer any specific question you people have. Just WhatsApp me or email me, and what you'll do is start taking the cases. And whenever you feel, just connect with Dr. Nair, and he can also have other maybe query resolution session with all of you, and we can take up your queries in that as well. Right, Dr. Nair? I think let's take up
Yeah.
the next segment
Sure,
of the
sir.
program. Thank you.
Sure, sir. That's a very tender lecture from your part. What I feel that we are all inspired. Why? Because a Vaidya should be foremost. He should be a Prayoga Chavira. He should be. He should convert the practice of medicine into an art, and that is what you are doing. So I once again congratulate you on behalf of the entire team as well as the consortium. And also, we hope that you will be with us in the referral board when we clinicians start practicing. You have already given your number and every other contact details, and we will be in touch with you when we manage the cases. I request you to kindly bless us with your support. Thank you, sir. Thank you very much. And
Sure. Thank you. Thank you all of you.
yeah, thank you, sir. Thank you.